Dr. Juliet Breeze, it has been quite a year for you. I want to start by talking about how you founded Next Level Urgent Care on the belief that it is in fact possible to provide quality medical care, cost efficient quality medical care for any patients who need attention for non-life threatening illnesses or injuries. What do you credit for proving that true? It's like you cracked the code.
Well, thank you, Kelly. First of all, thank you for letting me talk to you about this. It's my favorite topic. And it is one of those things. Now we are 9.5 years into this business. And when we started, it was so simple. All I knew for a fact that when I went into a freestanding emergency room and I got this enormous bill, that there was a better way. It was easy. And what happened to me was, gosh, nothing was really terribly wrong. We end up with $1,000 bill for maybe 10 minutes of care and a great prescription that we needed on a Saturday afternoon. That single event launched something that I could never have imagined. It seems so logical to me to try to start to do something where we found people who were willing to work on weekends as part of their shifts. And really the proof is that the business took off. We knew that we were addressing two things with our centers. We were addressing access and we were addressing cost. And during COVID, I kept hearing, oh my gosh, everybody's worried because people are afraid to go to the doctor, or doctors' offices are closing. Doctors aren't wanting to see patients anymore. And these things started me thinking, wow, we're going to have sort of a pendulum thing happen where people who would have otherwise gotten primary care, gotten good care, may have not gotten that care for either an access or a cost or a fear reason. We knew we were set up. We were perfectly set up for this. We had already had our facilities. We already knew how to do telemedicine, which I think is really going to forever be now incorporated into good primary care.
I agree.
And we had already launched a lab. So with all of that together, we just threw it all in a pot and said, this is a membership and we're going to sell this to employers and let employers provide $0 healthcare for their employees for those basic medical services.
Providing healthcare costs for employees is a huge line item in running a company. And so
yes,
they must be really pleased not only to be able to do what they can to ensure a healthy workforce, but to be able to provide that. What's their reaction been to this?
Well, I mean, I think what is shocking is that they're actually also saving money. And so, that's like the win-win.
Right.
I'm providing better healthcare for my employees. My employees are saving money, but so am I. And how the employers save money is that less people go to the emergency room for care, less people go to expensive sites of service for lab or for imaging, because they can get a lot of stuff done right at Next Level. But if they can't, then we have care navigators that help them, help their employees to get to more reasonably priced things, make sure that people stay in network. So the employers are seeing that providing a program like this is actually, it's a win all the way around. And talk about, retention and loyalty of employees.
Oh my gosh.
When employees
Absolutely.
get free healthcare, they're bound to stick around. Fee for service medical care is not the way we should continue to provide medical care. It doesn't incentivize the right behaviors. It is scary for patients because they don't know how much their visits are going to cost. And and for doctors, they do have an incentive to order that extra test or to do that extra thing because they actually get paid more if they do more. And it also incentivizes behavior like bringing people into the clinic when maybe they could just be checked on with a phone call, because they don't get paid as much for a phone call as they do for bringing them into the clinic. And so moving to a membership or a value-based system is really one of the most important things to me that I think we need to move to, just to better care for people, because we're caring for people in a very different way now post-pandemic than we did before. And people expect asynchronous communication with their healthcare team.
Can you spend just a moment talking about how important you and Next Level consider that provider patient communication as part of what characterizes the care someone gets with Next Level?
Being a patient is a very vulnerable position to be in. You are putting your trust in people that you don't know, and you are seeking care from people. You are coming in with an issue that you want someone to solve. That makes people hyper aware of how they're being communicated with. They have expectations, and they are even more interested in making sure that they are being heard, and that the communication that's coming back at them feels genuine and feels compassionate. I tell people all the time, it's just as important how you make a person feel in the interaction as what kind of medicine you prescribe. Yeah. And that is a very different kind of take on things than the traditional doctor view of the world, which is they're lucky to have me and let me, write my script, and I don't have to be a personality. I don't have to be, all that caring. I just have to do my art. Our world has changed, and our patients are consumers, and they expect a level of service, and we have to rise to meet that. So we do appreciate all of the fabulous consultation that we've gotten on how to really perfect our communications and really focus on what matters to people.
Congratulations to you, and thank you for your time. But congratulations to everyone that is so appreciative of all that you're doing.
Thank you very much, Kelly. It was a pleasure to talk to you, and thank you for all of the work that you've done with us.